Magandang araw. Welcome to Policy Insights for more efficient and adaptive social protection in the Philippines. This virtual knowledge exchange is co-organized by the Philippine Institute for Development Studies and the World Bank. I'm Sheila Siar, your MC today. Our forum features two resource persons from PIDS and the World Bank. They will present the highlights of each institution's studies on social protection, sharing what works and what needs to be fine-tuned. This will be followed by a moderated discussion with a panel of practitioners and advocates of social protection and poverty alleviation. Through this discussion and your participation, we hope to draw out policy insights on strengthening social protection to make it more efficient and adaptive in the Philippines. Please refer to the event kit sent to you in advance for the profile of our distinguished speakers and panelists. We've allotted time for an open forum, and we encourage you to participate. You may post your questions and comments in Zoom's Q&A box, and please indicate your name and organization if you'd like to be identified when we read out the questions. This forum is live streamed on the Facebook pages of PIDS and the World Bank, so we will also be taking questions from those platforms. Facebook viewers can post their questions in the comment section, and we will try to accommodate as many questions as possible during the open forum. To our Zoom participants, if you have questions about the platform, please ask them in the chat, and our team will respond to you. Finally, for everyone's information, we are recording this session for documentation purposes. To start the program, you'll have the welcome remarks of Dr. Marife Ballesteros, the Vice President of PIDS. Dr. Ballesteros has written and published papers on a wide range of subjects, including housing and land policy, agrarian reform, rural finance, and social enterprise. A member of the International Development Evaluation Association, she has been involved in several impact evaluation studies. Dr. Ballesteros, over to you.
So thank you, Sheila, for the introduction. So to those joining us online and those watching through the PIDS and World Bank Facebook pages, good morning. On behalf of PIDS and our event partner, the World Bank, I welcome you to this virtual forum on policy insights for more efficient and adaptive social protection in the Philippines. In light of the VUCA world that we now live in, this forum on social protection is an opportunity to step back, take stock, and assess how responsive are the existing social protection programs to the current challenges that the Philippines is facing. Social protection, as most of us are familiar with, consists of programs and policies that seek to reduce poverty and vulnerability to risk of the marginalized sectors of society. As with other countries, the Philippines adopts a combination of different social protection components, which include the labor market interventions that focus on enhancing employment opportunities, social insurance, which are programs that protect beneficiaries from loss of income or from unemployment. Social welfare, which seeks to support the minimum basic requirements of the poor through cash or in-kind transfers, and the social safety nets, which are programs provided as urgent responses to address the effects of economic shocks and disasters. When COVID-19 pandemic struck, we saw the importance of social protection in sustaining the adversely affected households and small businesses. However, it also exposed weaknesses and gaps in our current social protection programs in terms of access, implementation, and targeting. For instance, in a 2021 study of PIDS, it noted that the Filipino migrant workers who were heavily affected by the pandemic have low access to health insurance, social pension, and basic workplace benefits. This was most prevalent among poorer households, less educated individuals, and those living in rural areas. The same is true for government's social pension program for the indigent senior citizens, who also bore the burden of the impacts of the pandemic. A PIDS study also in the same year showed that the application, targeting, and distribution issues made it difficult for senior citizens to benefit from the program. We have also witnessed the challenges faced by the government in implementing the social amelioration program that benefited about 32 million Filipinos. One of the main problems was a delay in the distribution of the ayuda due to difficulty in identifying eligible beneficiaries. There also have been reports of ineligible individuals receiving the cash subsidy. These issues highlight the need to improve and strengthen the country's social protection system, and we need to assess and learn from our experiences as well as from other countries to determine what works and what does not. So this morning, we will hear from two speakers who will share lessons on how to improve social protection in the Philippines. We have PIDS President Dr. Aniceto Orbeta Jr., who will talk about the insights from various PIDS studies on social protection. We also have World Bank Senior Economist for Social Protection and Jobs Global Practice, Dr. Yoonyoung, who has done extensive work on social assistance in the Philippines during the pandemic. Our discussion will not be complete without the insights of those on the ground, and we are honored to have Department of Social Welfare and Development Assistant Secretary Rhea Peñaflor, Remancy Organization for Asia and the Pacific Executive Director June J. Perez, and Innovations for Poverty Action Philippines Country Director Dr. Nasrina Badiri. Thank you for accepting our invitation. Let me also take this opportunity to thank the World Bank Philippines for co-organizing this event with us and for their continued partnership with PIDS on knowledge exchange activities that are relevant to Philippine development. To our audience, let's look forward to an active and fruitful discussion with you during the open forum. Thank you for joining this event. I now give back the virtual floor to Dr. Shah.
Thank you very much, Dr. Ballesteros. At this point, we will hear from our resource persons, and while their presentation is in progress, you may post your questions on Zoom and Facebook, and your questions will be asked during the open forum. Let me invite first Dr. Aniceto Orbeta Jr., who will present the key findings of various PIDS studies on social protection. Dr. Orbeta, the president of PIDS, has extensive experience in impact evaluations of programs and policies, and these evaluations cover a variety of thematic areas, including education, social protection, community-driven development, and agricultural finance. Dr. Orbeta, over to you.
In this presentation, I will summarize the social, as mentioned, protection research done by myself and my colleagues at PIDS, whose names is listed here. I have asked them actually to be here so that they can help me answer the questions in the open forum. The objective is to highlight important issues in social protection in the country and perhaps provide a more comprehensive background to complement the succeeding presentation by Dr. Chu of the World Bank. I will be using this outline. I designed the presentation this way to provide a comprehensive background to social protection, expecting a heterogeneous audience we find in most of our public seminars. It starts with defining the scope of social protection and organizing the presentation using the official social protection framework promulgated by the Interagency Social Development Committee. I'll comment on the components as I go on and provide concluding remarks. This statement provides the official definition of what social protection in the country is. The keywords I'd like us to remember are that SP is about policies and programs that A, seeks to reduce poverty, B, inequality and vulnerability to the risks, and enhance social status and rights of the marginalized. This is the current official social protection framework updated by the SDC in 2019. It starts from the basic principles at the bottom to the objectives on the top. In the middle are strategies, coverage, components, and the type of risks. To give everyone a good perspective of what basic social protection desires to provide, in the following slides, I will describe the developments in the analysis and elements of the social protection floor, namely social health insurance, the income security for children, and income security for the elderly, and income security for the working age population. Starting with social health insurance, we usually analyze performance of social health insurance in 3 dimensions. One is population coverage, that is how many individuals are covered. Service coverage, that is how much of the health services are covered. And finally, financial coverage of how much the health expenditures are covered. Starting with population coverage, when I look at it in 2018, I already found that there is almost a universal coverage. This is evident from the PhilHealth data shown in the table on the right, revealing that 89% is covered in 2021, and it is from 87% in 2014. There is some slowdown during the pandemic, but high coverage is evident. It is noticeable that a large proportion of members are indirect contributors, consisting of indigents, seniors, and sponsors. For instance, in 2021, this is still 37%. I noted earlier that this group was the source of a significant group of population coverage, particularly when the country embarked into compulsory coverage for pantawid beneficiaries starting in 2011, until the number of beneficiaries stabilized at around 4 million in 2014. The compulsory coverage for indigent seniors of 60 years and above came sometime later under the National Health Insurance Program, or RA 1065645, signed in 2014 and reiterated in the UHC law in 2019. All these are funded by the so-called sin taxes under RA 351. All subsequent growths will come from the direct contributors. As you will see, presented also our survey data from the National Demographic and Health Surveys, which show a bit lower coverage. However, it also provides useful information, such as the large disparity of coverage across socioeconomic groups, such as a difference of 20% between the poorest and the richest in 2017. Turning to services coverage dimension, PhilHealth reports the access of providers, including health facilities and professionals. It also has data on members type by select number characteristics. Finally, they also report access by illness. These reports, however, do not include an proportion to the total illness incidence that will allow an analyst to do an illness level service coverage. A recent study, to give you a flavor of how is it in terms of service coverage, a recent study by Jana Uy and colleagues on PhilHealth released in 2011 highlighted 3 patterns. One, the claims are hospital inpatient centric, despite the UHS primary care focus, highlighting the need to expand primary healthcare benefits. 2, the inequitable concentration of payment in NCR and Luzon amounting to 60% of claims, which he explains to be primarily because 63% of licensed hospitals are in the area. And 4, the underutilized leverage of PhilHealth as a national strategic purchaser to promote primary healthcare and the formation of service delivery networks. Finally, on financial coverage, PhilHealth reports shows expenses by member type. A better sense of financial coverage would require computing financial coverage by illness. Again, Janoy and colleagues highlighted the muted financial coverage, pointing out the still high reliance on out-of-pocket spending, which is still 44% of total health expenditures. It should be noted that the primary aim of social health insurance is to reduce out-of-pocket costs so that illness will not be financially dislocating for the patient. In summary, one can see that in terms of population coverage, it's almost universal. So the remaining challenge for social health insurance is improving service coverage, financial risk protection, and equity. Looking at other dimensions of the PhilHealth program, Mike Abrigo's study released in 2020 did informative simulations. He finds that the benefit package are progressive. The study also showed that while individuals are net contributors in their early teens to mid 30s, they become net beneficiaries for a large portion of their lives, starting in their late 50s. Furthermore, he finds that the lower socioeconomic class transitions into net beneficiary status earlier. And finally, he pointed out that the surpluses from high-income individuals may not be sufficient to cover a projected deficit, putting pressure on the system's financial sustainability. Now, turning to the income security of children, as you may know, the two main interventions are the Pantawid Pamilya or 4Ps and the feeding programs. To avoid confusion, it is worth reiterating that 4Ps secure the future, not the current income of children. So some of the results of the several rounds of impact evaluations of the programs that we did show a consistent positive impact on school health attendance, including elementary school in earlier years and older children in more recent years. I want to highlight, though, that up to now, we're still not able to assess the impact on learning. A relevant question in this area is, how do we know that we know that they are attending, but are they learning? That's the question that we want to answer. On health, we found a positive impact on healthcare utilization, but the impact on nutrition is mixed. A relatively recent study by Dr. Abrigo and colleagues shows that the empirical evidence that we suspected all along, that distance and the quality of education and health facilities matter. In addition, they find that 4Ps provide some protection against supply-side limitations. In the case of school feeding programs, a study by Drs. Abunda and Albert and colleagues find that school feeding improved the attentiveness and sociability of beneficiary pupils. However, they also found that nutritional gains from feeding programs are not sustained beyond the 100 to 120 feeding cycle. Now, an exciting result on malnutrition by Dr. Olive is depicted in this graph. It shows that chronic malnutrition indicated by stunting develops in the first 1,000 days. Chronic malnutrition is known to be a large contributor to a child's cognitive development. The graph shows that the negligible difference at birth between socioeconomic classes rapidly develops into a profound disparity between 6 to 24 months of age. Beyond 24 months, disparity in nutrition status by income class is essentially maintained. This means that if we want to intervene to arrest long-term malnutrition, we must do the strategic intervention between 6 to 24 years. This also means that whatever we do at the school at school age has muted impact on chronic malnutrition, even if it has known to be, as shown earlier, to have other effects. Now, let me turn to the income security for the elderly. The programs for the income security for the elderly consist of two types. One is the contributory component with the SSS for the private sector workers and the SIS for the public sector workers. And the other is social pension program for the needy elderly. Starting with the contributory program, these are risk pooling mechanisms. It needs to, because it is such, we should recognize the basic elements of a risk pooling mechanism. And it says that the basic element that we should always remember is that the benefits and premiums should be synchronized to make it sustainable. If we want the funds to be sustainable, we should resist the temptation of misaligning benefits from premiums, no matter how politically popular. We should not be buying political popularity at the expense of hard-earned contribution of members. Another thing I'd like to emphasize is that, and often forgotten, is that these funds are essentially private funds contributed by and owned by members rather than a public fund to be used for public, to finance public objectives. Having this correct perspective provides a firewall against the use of these funds that may compromise its sustainability. In contrast, the non-contributory, pensions or social pensions, the funding of the system is much more assured because of the contribution and also the sovereign guarantee. Now, turning, like us to inform that there is another pension system for the uniformed personnel, which became a non-contributory because of the dissolution of the RSBS in 2016. For non-contributory systems, we should always weigh the benefits against the fiscal burden. A recent analysis by our macro team on the fiscal burden done by Drs. Diboki Gonzalez and Jukno Sikat reveals this threat to long-term fiscal stability of this non-contributory pension program for uniformed personnel. Now, let me turn to the social pension. A recent analysis done by Dr. Albert and colleagues in 2021 revealed that there's a considerable increase in the reach of old age pensions in the country, as illustrated in the graph on my right. Among the pension coverage, SOCPEN is the one that expanded a lot in recent years, from 2% in 2011 to 38% in 2020. However, they pointed out that despite the 2018-2020 revalidation, inclusion, exclusion, and targeting errors persist. Nonetheless, they also pointed out that the program is viewed positively by both implementers and beneficiaries, even if the current cash assistance is messy. According to the most recent publicly available data on family income and expenditure survey, it covers only less than a tenth, to be exact 7.5% of average expenditures of food and health at the bottom half of the per capita income distribution. They recommended that the program adopt strategic policy actions, such as strengthening the monitoring and evaluation mechanisms and relinking the definition of indigency to senior citizens' income levels to prevent system gaming. On the other hand, Dr. Reyes and colleagues pointed out that the amounts and frequency of payout need to be revisited. Dr. Abrigo and colleagues quantitatively estimated that the current expansion increased coverage by 16 percentage points. It has also increased health expenditures, indicating a shift in healthcare demand upwards. Finally, since this is not a contributory program, it needs funding assurance. For now and until allocated somewhere else, Syntax is paying for the social pensions. Now, turning to the pensions of working age population, my analysis around 2008 revealed that the laws cover almost all risk and cohort. These tables, which has the risks and contingencies in the rows and cohort in the column, shows that there is an institution providing the needed service for each cell. For instance, we don't only cover formal sector workers, but household help and informal sector workers. In addition, we recently added unemployment insurance in the new SSS law, RA 192. The only exception is platform workers if they don't consider themselves as self-employed. However, being covered by law does not mean actual coverage. This table shows the actual coverage as far as universal is far from universal. For instance, in the SSS systems, only half of the private wage and salary workers are contributing. Almost 30%, at most 30% of own account workers are contributing, and at most quarter of OFWs are contributing. Analysis by Baduy and Dakoykoy and colleagues shows that the system discriminates against women, and Tabuga and colleagues also highlighted the low coverage of OFWs. Bayudan and Dakoykoy and colleagues pointed out that there's a need to design a system appropriate for evolving forms of work, such as platform work, that consider varied work arrangements and portable from one work engagement to the next. Now, turning to labor market programs, let me start with training. The recent research by GP Corpus and myself reveals issues and insights about TVET training from the perspective of trainees, trainers, and employers. Let me provide some of the highlights. From the perspective of trainers and employers, financing determines the demand and viability of the training from the training institute perspective, and is considered important even among trainers. There is a prevailing misconception as well that TVET leads to low, dirty, and jobs affecting the training demand and trainer suppliers. In addition, there is a perennial concern about the quality of training schools, trainers, and assessors. Still, another concern is the perception about training content, that it lacks soft skills like communication skills and workplace discipline, and training regulations are not up to date with the current industry practice and technologies. Finally, COVID-19 highlighted the need to improve the capacity for flexible learning delivery. For the trainees, on the other hand, the issues include, again, financing because they need allowance while on training, and lack of information dissemination of the training facilities. However, you have promoted it, they say that there's still lack, and lack of labor market information and employment facilitation. And during COVID, what they found is that they have lack of access to remote learning that may be available during that time. Studies on employment generations, the next set of programs, both in early studies done by Manasan in 2010 and the recent studies done by BEAM in 2017 show that employment generation is low and the cost of programs high, resulting in a very high cost of cost of generated employment. They also find that they tend to miss their identified targets. Ballesteros and Israel pointed out that their employment impact is transitory and then short term. Studies on job fairs done by BEAM in 2016, which actually earned a comment from the newly installed Secretary of Labor, shows that job fairs do not increase overall employment. It has, however, found to encourage people to move towards the formal sector. Now, let me try to comment on unemployment. After a productive discussion starting before 1990s, we have included a form of unemployment insurance in the new SSS law passed in 2019. In a recent discussion on this, we pointed out that the useful objective of unemployment should not be protecting current jobs, but improving income security. This objective clarifies that the right strategy should not only be to protect against income loss because of job loss, but more importantly, facilitating finding a new job. This means a strong training, job counseling, and employment facilitation accompanying the income loss. Because we have a good share of natural calamities, our social protection system should include disaster response mechanisms explicitly. The review of policy programs and funding done by our DRM experts, Dr. Domingo and colleagues, have identified progress in this area, including having an enabling law, RA 10121, and having a DRM plan in 2011-2018, which of course needs updating. But despite this, experience has shown that the leadership still needs to be clarified. An important observation the team had is that there is a considerable unutilized DRM fund because of confusing authorization. They also pointed out that we need to improve and utilize available information for better targeting and disaster resilience capacity building. We should religiously document our experience from calamities and subsequently use this information to inform and improve targeting and disaster resilience capacity building. A comment on poverty alleviation in the role of intervention programs is in order. On poverty alleviation, it's worth mentioning that there's a growing evidence of a consistently good performance of multi-intervention programs in improving conditions of the poor compared to single intervention programs, particularly for the ultra poor. Strength lies in recognizing that the poor faces many challenges simultaneously and that need to be addressed simultaneously. Consequently, it highlights the weakness of a single intervention program, and also it's worth pointing out that this is consistent with the convergence studies that is explicitly mentioned in our social protection framework. It's heartening to note that we have a ongoing pilot on Region 6 facility by ADB that will help us assess whether the same results are obtained under our conditions. We need to have our own experience on these multi-intervention programs. The unresolved challenge, of course, is the high cost of the simultaneous intervention programs. Now, before I conclude, I'd like to highlight the lessons from COVID-19 pointed out by PIDS studies. The World Bank presentation that will come next will highlight the nuanced findings from the several rounds of surveys that they did during the pandemic. One of the importance, one is the result that we would like to highlight is that the already built-up systems, such as the 4-piece information and payment systems, is very important rapid response in distributing the ayuda. Transferring the ayuda to 4-piece beneficiaries was as easy as transferring the money to the payment infrastructure built up for the program. The distribution of the ayuda to 4 million 4-piece beneficiaries was done in a couple of weeks. The rest of the non-4-piece beneficiaries, you had to undergo identification, listing, validation first before money transfers could be implemented. delaying delivery for months. The COVID-19 studies compiled in a recent released book by PIDS, edited by Dr. Reyes, my predecessor, highlighted the importance of interoperable databases in crafting effective and timely policies. In addition, it also highlights the need for granular data for effective data-driven responses. A recent study by Gonzalez, Zipicha, and Corpus highlighted the need for active labor market policies to reskill the workers. Finally, using the secondary data highlights the uneven impact of the pandemic across socioeconomic classes. For instance, in remote learning in educations that I find, and the insurance claims that Jana Oy and colleagues find, and the demand for healthcare of vulnerable groups, senior citizens and children, by Dr. Olive. Let me conclude with 6 statements. One is we should mind the critical elements of risk pooling mechanisms. Risk pooling mechanisms such as shared insurance or contributory pension systems should never forget the critical element that makes the system work. In risk pooling, we should always remind ourselves that benefits should be in sync with premiums. And one cannot expand benefits without commensurate increase in premiums to pay for it. In addition, we should also remember that there are other things like asymmetric informations between buyers and sellers, as well as strategic behavior, such as moral hazard. Second, we should realize that there is an open trade-offs between short-term and long-term objectives. In the short term, we want to respond to emergencies and not mind long-term effects on incentives and operations of markets. Over the long term, however, we want to build capacities to make our communities resilient, and we need to target better as well. Third, in many of the papers I mentioned in presentation, as you have noticed, the lack of working monitoring, evaluation, and more importantly, learning systems is a common refrain. I used to say in my evaluation classes that our bleeding hearts will never make our projects work, policies works. Instead, we need to measure, evaluate, and learn. We should not be satisfied with delivering our interventions. We should learn from them. Implemented policies, programs, and policies are rich source of learning to improve design of subsequent interventions. They are rich source of critical information such as our beneficiaries, our capacities to implement, and the environment in which we operate. Unless this information and analysis are translated into better policy and program design, we will not progress towards achieving our social protection objective faster and better. Next is cost-benefit analysis. When we see cohorts of populations left out in development, we often think of direct government intervention. In the short run, this may be justifiable, but we must always realize that over the long term, we need to assess the cost and benefits of alternative service delivery methods. Government direct intervention may not always be the most efficient way or even effective way. And the cost-benefit analysis will point us to a better alternative. Now, in the case of unfunded mandates, when we provide benefits, we should never think that it should be funded and the implications that it has, so that we will know whether we can sustain the unfunded mandates or not. So that's the basic principle that we have for unfunded mandates. And finally, I'd like to emphasize that in many social protection areas, almost every targeted beneficiary is already covered by some law. We have seen this in the case of health insurance and programs addressing many risks to the working age population in the private and public sectors. When we look at actual coverage, however, we see the gaps. That's the challenge. Closing these gaps is what we should be focusing on. In addition, improving the efficiency of the operations of those programs will always translate into better coverage. Thank you very much for your attention.
And thank you very much, Dr. Orbeta, for your comprehensive presentation. I noticed that some of you typed in your questions and comments on the chat box. A gentle reminder to please use the Q&A section for your comments and questions. Okay, so we will now have Dr. Yoonyoung, who will share insights from her recent World Bank study on social assistance. Dr. Cho is a senior economist in World Bank Social Protection and Jobs Global Practice. She guides a team that supports the country's safety nets, including the flagship program Pantawid Pamilyang Pilipino. Dr. Yoon, you may proceed.
Thank you so much. Magandang umaga. As highlighted in the earlier presentation, social protection includes many different instruments, including cash transfers, social safety net, labor market interventions, and social insurance and services. Among these, social assistance is the most common in the Philippines. The Pantawid Pamilyang Filipino program, the 4Ps, Social Amelioration Program, SAP, Social Pension for the Indigent Elderly are among very well-known programs, and they play very important roles in protecting poor and vulnerable households in the time of crisis. The country may be transitioning out of the pandemic, but it is exposed to frequent shocks and disasters. In this context, it is critical to look back and review social assistance response to the pandemic and reflect on the lessons to build resilience for future shocks. The COVID-19 pandemic was not a monotone event. As you may recall, there were multiple phases of the pandemic varying by the health policy environment, including the knowledge on the virus, vaccine availability, as well as lockdown measures. During the initial lockdown period, when the Philippines used more stringent measures than other countries, a large-scale social amelioration program was introduced over 2 tranches, building on existing programs, including 4Ps. During the later phase of the pandemic, localized ayuda, mostly in-kind support like food packs and the assistance to individuals in crisis situation became the main response mechanisms. Our study used multiple nationally representative data to capture households' well-being and program implementation. Some of the key aspects that I will present today include social assistance coverage, adequacy, targeting, and delivery of social assistance programs. The government has only finite resources. Therefore, covering as many households as possible with an adequate and meaningful amount of benefits within the budget is critical. For that purpose, targeting the poorest and most vulnerable households and providing benefits in an efficient manner is necessary. So let's look into these 4 dimensions one by one. So the first on coverage, globally, as the graph indicates, countries with greater pandemic shocks tend to implement cash transfer with a larger coverage, reflecting the political economy of social assistance. The Philippines experienced a greater reduction of GDP per capita growth compared with the other regional peers, and the government introduced a large-scale program. While the program's coverage rates differ by data sources, the Philippines' coverage is quite large, greater than regional peers. Rapid contingency financing to support the program of this scale through biennial laws was very impressive. Such social assistance played an important role in mitigating the negative shock of economic downturn due to COVID-19 lockdown measures. The World Bank estimates suggest that the poverty rate could have increased even further by 2 percentage points, meaning that close to 2 million additional individuals could have fallen into poverty without social assistance measures. However, given the sheer magnitude of shocks and prolonged period of the pandemic, social assistance fell short of the daunting need. In fact, despite the transfers, a huge share of households reported income declines, hunger, and mental health issues due to the pandemic. The impact was also quite heterogeneous by region. The regions that experienced a greater shock, such as NCR or Calabarzon, or those already in a deeper poverty like Barm express their economic distress and income declines. In light of these increasing needs in the middle of fiscal constraints, diminishing targeting performance is of concern. The first graph on top shows the distribution of 4Ps beneficiaries by their income level. During the pilot stage of 4Ps in 2009, almost 92% of 4Ps beneficiaries belong to the bottom 40% of income distribution, which is an outstanding figure globally. However, the share has declined over time, and by 2020, during the pandemic, only slightly over 60% of 4Ps households are from the bottom 40%. Similarly, as the bottom graph shows that at an early stage of 4Ps as a nationwide program in 2013, almost 60% of the poorest households were able to benefit from the program. But in 2020, only 35% of the poorest households benefit from the program. This indicates that there are many families outside 4Ps that need the program support, but they are unable to receive it. Thus, the program should be able to facilitate active graduation of better off families and enrollment of new families so households in the greatest needs can benefit. Despite diminishing targeting performance of 4Ps, indeed, 4Ps provides the most progressive support among available social assistance programs in the country. Other regular programs, including social pension and DSW relief, relatively speaking, show progressive support, although not as well targeted as 4Ps. However, if you look at the bottom graph, social amelioration programs or LGU's Ayuda or other NGO support seem significantly less well targeted and sometimes even regressive. These findings show that objective targeting based on the social registry of Listahanan provides a very solid basis for prioritization of poorer households, but with a lack of updates in Listahanan and limited dynamism, targeting performance has been diminishing over time. Finally, COVID-19 social amelioration program response greatly highlighted the need for enhancing social assistance delivery. The first tranche of SAP experienced huge challenges with manual processes and physical cash delivery. Globally, countries that had a national ID, registry, and digital payment mechanisms were able to deliver assistance quickly during the pandemic. When the pandemic hit the Philippines, there was no immediate mechanism to identify and verify vulnerable households. The national ID was not operational yet. Updated Listahanan was not available, and a large share of people were unbanked without access to digital payments. Learning from the first tranche SAP, the second tranche introduced digital cash delivery through 6 financial service providers, but lack of clean database, beneficiary database, delayed implementation. Nonetheless, digital delivery of payments through large agent networks shows very promising results for reducing travel, queuing, and processing time with very high beneficiary satisfaction. COVID-19 was already devastating, but at the same time, the country went through African swine flu and Typhoon Odette. Prices increased, especially in fuel and food, stemming from the war in Ukraine, and looming global recession are again reminding that shocks are very frequent and repeated, and that government response to help poor and vulnerable households should be swift and fair. This requires an efficient and adaptive social protection delivery systems. For this purpose, I'd like to highlight a few important areas for further strengthening. First, contingency financing mechanism should be streamlined for better preparedness to the disasters. I agree with Dr. Orbeta's assessment on the importance of simplifying the bureaucratic process of activating and using the calamity funds. Second, there should be a clean beneficiary and citizens database which facilitates better targeting, identification of beneficiaries in the time of crisis. Recall that prioritizing those in the greatest needs enhances fiscal efficiency, meaning greater impact for peso spent. Third, distributing a large quantity of food packs to people in an untargeted manner is very prevalent in the country. However, it is quite inefficient. It is very important to shift the main mechanism from untargeted food assistance to targeted cash transfers as soon as the market becomes operational. Fourth, when delivering cash transfers, using multiple financial service providers for digital payments will enhance greater access and convenience for beneficiaries. Utilizing the rapidly developing and growing digital finance ecosystem for government transfers will greatly help. Finally, overall delivery systems can be enhanced using digital tools. This does not mean that poor beneficiaries have to become internet experts. Rather, wherever feasible, the implementers use digital tools and platforms for swift response so they have sufficient time and energy to care for beneficiaries. Good news is that the National Foundational ID, the PhilSys, the Philippine Identification System, PhilSys, holds a key to many of these recommendations, and it has made huge progress during the pandemic. PhilSys is not just another ID. It is a foundational ID that should be universally available and usable. I'm aware that many people are waiting for the PhilID cards, but in fact, more than the card itself, the PhilSys number that contains key information is what's important. The Philippine Statistics Authority should be expediting the use of mobile ID or QR code that works without the physical card. When the PhilSys is adopted by social assistance programs and processes, it can help clean up the database, establish the unified beneficiary database, facilitate the compilation of multiple sources of information for better and dynamic targeting, help information systems talk to each other, and enhance financial inclusion and digital payments. All of these and improve the efficiency will free up the resources and reduce the hassles from paperwork, enhance adaptiveness of social assistance response, which will strengthen the program's impact and improve citizens' well-being. Thank you so much for your attention.
And thank you very much, Dr. Yoon. So at this point, let's go to our panel discussion to be moderated by Dr. Michael Abrigo, a senior research fellow at PIDS who works on population, health, and nutrition policy issues. Dr. Abrigo, over to you.
Thank you so much, Sheila. Good morning to everyone who are viewing us on Zoom and Facebook Live. I noticed in our Zoom live chat that we have people tuning in as far north as Ilocos Norte and as far south as Davao City here in the Philippines. We also have people tuning in from other countries. We are honored to be joined today by 3 development practitioners and experts from government, the private sector, and civil society. We have the SWD Assistant Secretary for Specialized Programs, Ms. Rhea Peñaflor, Mr. Jun J. Perez, the Executive Director of Remansi Organization for Asia and the Pacific, and Dr. Nasrina Nash Sampaco Badiri, the Country Director for Innovations for Poverty Action, Philippines. I encourage the audience to refer to the event kit that we sent to you in advance In there, you'll find significant contribution of each person in our panel in the fields of social protection and poverty alleviation. While we are having the panel discussion, participants who are joining us virtually may already leave comments and questions anytime in the Zoom chat box or in Facebook Live. You can ask questions to the panel or to our two presenters, Dr. Orbeta and Dr. Yoonyoung. I'd like us to start with a Zoom poll. You've heard about multiple priority areas to advance the social protection reform agenda. Which of those for you is the most important area to advance the reform agenda and should be prioritized by the new administration? Go to the Zoom screen and choose only one answer from the following. So we have financing, including contingency financing, accurate and updated list of beneficiaries enabled by PhilSys, use of digital platforms for registration, payment delivery, grievance and feedbacks, and others, policy for better targeting and prioritization of beneficiaries, institutional arrangement and coordination, such as Mandana's ruling, coordination with donors, interagency coordination, and finally, monitoring and evaluation for learning. So you may key in your answers. So while the votes are being counted, let me ask our panelists very quickly in one or two short sentences. Asikreya, tell us one priority area that is particularly resonating with you and why.
Yeah, good morning, everyone. Item number 2 particularly resonates with me because an accurate and updated list of beneficiaries enabled by PhilSys is the first step in delivering social protection programs to our beneficiaries. Authentication is the first step, and of course, the second step should already be cash transfer or the release of social protection programs. Hence, it will cut down other steps and will ensure speedy delivery of programs to the most vulnerable beneficiaries. There's a need of a mechanism online where eligibility requirements are verified by the respective government agency like ours, the SWD, for example, unless these are subsidies where the names are already in the payroll that have been verified. Back to you.
Thank you, Asikreya. How about you, Dr. Nash?
Thank you so much, Doc Mike. Monitoring and evaluation for learning really resonates with me, especially, for us to be able to gather lessons, learn, and improve the design of programs. We should ask our questions. Are we reaching those we want to reach? Are we implementing the programs as we plan to do so? Are there ways to improve how we deliver these programs, right? And so MME can inform operational management and decisions about the programs and help us achieve our goals in a more efficient way.
Thank you so much, Dr. Nash. Finally, Mr. Junjay, similar question. What priority area resonates with you, or would you like to add anything to the list and why?
Thank you and good morning. I would say in the area of financing, given our country's high exposure to natural catastrophes, we have heard already from the presentations the effectiveness, for example, of risk pooling, risk protection programs like insurance in terms of after a disaster, and a combination of such with other financial mechanisms such as access to credit and emergency aid. In fact, one of the recent studies of the University of Cambridge, they made this impact study on Typhoon Haiyan, Typhoon Yolanda affected insured and non-insured households, and they reported that families that had micro insurance had almost immediate access to resources to provide for their families' healthcare needs and restart their business now. And so I think financing risk protection services should be on top of our priority. Thank you.
Thank you so much, Mr. Junjay. Thank you for our panelists for their answers. We're now ready with the poll results. The top 3 priority areas for more efficient and adaptive social protection, according to our audience, is number 1, at 36%, policy for better targeting and prioritization of beneficiaries. Second, 23%, accurate and updated list of beneficiaries. And then we have those with ties, financing, institutional arrangement and coordination, and finally monitoring and evaluation. Thank you so much for joining our poll. So Now let's go straight to asking our esteemed panelists about their experiences or views on social protection. For these first round of questions, I want us to talk about efficiency in social protection. In the context of our fiscal constraints here in the Philippines, fiscal efficiency is crucial to achieve the greatest bang for buck. Let me ask our panel, to Dr. Nash. One way of ensuring fiscal efficiency is prioritizing the most vulnerable populations through robust targeting. For instance, in recent years, one of the challenges faced by 4Ps has been the lack of new enrollment of pregnant women and 0 to 5-year-old children, which limits program impact. What is your assessment of the strengths and weaknesses of the current targeting system used in major social protection programs in the country? And what would be your advice to strengthen it?
Thank you for that question. Various social protection programs, as we've heard from Dr. Orbeta and Dr. Yoon, really are meant to target certain populations depending on the objectives of the program. Targeting helps us understand whether we are reaching the people we want to reach, which we can measure as well through a well-designed M&E. 4Ps as a conditional cash transfer program, for example, has been designed to reach certain households through targeting tools. These households must be in a certain poverty threshold, must have very young children or school-age children. We know that effective identification of the target population is extremely important to the success of social protection programs with the limited resources that we have. The government, through the DSWD, has already set up a standardized targeting system through the National Household Targeting System for Poverty Reduction, or Listahanan, which is used by the DSWD for its various programs. The Listahanan has been seen as a good example of a targeting system for CCP programs. However, there are some points to consider when we're looking at the Listahanan. One is the need to regularly update the registry. I think this was already mentioned by Yoon as well. And updating data to reflect the shocks that people are facing right now. We need to understand how we can do targeting in a dynamic way and make programs more responsive to shocks. Given the costs and resources needed to collect data for these types of registry, we know that these can be costly, but it would be good to really understand how we can do this better. Improve data collection methodologies through the use of technology for efficiency, use of latest data quality protocols, and effective data management for faster processing. It's also important to note that we should leverage and integrate Listahanan with PhilSys, for example, as already mentioned, for National Data Management Framework. And as Yoon also mentioned earlier, a good citizen database can help improve targeting of social protection programs. And lastly, I would also note that it's important to leverage the registry and be able to coordinate between government agencies in the use of these registries so that we can really further maximize its value.
Thank you so much, Doc Nash. For Mr. Junjay, another way of achieving efficiency is through digital payments and reducing physical delivery. By having a digital trail of funds, the government can trace where funds go and reduce potential leakages and fraud. Due to internet connectivity or phone penetration issues in the Philippines, some people are concerned that the poor and other vulnerable populations, especially those in the rural areas, are not ready for digital payments. What's your view on this?
Yeah, I agree that the use of digital payments is still a challenge, especially for the low-income sector. In fact, the Bangko Sentral ng Pilipinas Financial Inclusion Survey reported that only 1 in 10 adults use their mobile phones and the internet for financial transactions, for lack of awareness, lack of trust, or weak, slow internet connection. And you'll be surprised that the lack of awareness is the most prominent reason for not using the financial services. But in our sector particularly, we have seen some gains already in this area among our membership in the among the poor and low-income households. For example, Card MRI Group, the biggest group of MFIs and microinsurance providers in the Philippines, their Connect to Card digital payment platform has already more than 2.2 million registered users now. But it was also a long journey for them to before achieving this number, and using a lot of client awareness, education campaigns to get buy-in. Also, in efficiency through digital platform is also very important for our business model in microinsurance. We currently strive to pay claims within 1 to 5 days from the date of notice. But with the recent availability of mobile apps, we have raised the standard of turnaround time for payment of claims in 8 to 24 hours. So the use of a digital platform is really the way forward.
Thank you so much, Mr. Junji. It's quite interesting that the lack of awareness is the top reason for why people are not accessing digital services. As a CREA, DSWD built on the lesson learned from the first tranche of the social amelioration program and introduced digital payments by partnering with 6 financial service providers. However, digital payments also face challenges due to the lack of accurate and updated data, ineffective beneficiary targeting system, and absence of a foundational ID. How is DSWD addressing these challenges?
Yeah, taking into consideration all those challenges that you mentioned, and the department has faced during the pandemic, we saw the need to enhance the digitalization of our systems and our processes. In our strategy, we identified information capital as one of our roadmap deliverables in order to promote an informed and evidence-based decision-making through active utilization of credible and reliable information management systems. This targets the development of fully functional information systems such as the DSWD Unified Beneficiary Identification Database, or what we call the UBID. The PSA is currently working as well on increasing the production of the physical ID cards currently printed at the BSP, and will launch the printable version of the national ID that can be printed at the PSA registration centers. This will increase the number of registrants with national ID, either physical or printable. And as of June 24, 2022, PhilSys as a platform has registered almost 70 million under its system, and we are grateful for the partnership that we have with the PSA under the PhilSys Use Pilot Project of DSWD, because this will address the lack of accurate and updated data. Let me also reiterate that we advocate not the physical ID like what Yoon has said earlier, but even just your QR code or a soft copy of your national ID, because it will be unique anyway, as it will have your information only unique to you, and it should be accepted whether or not it is a physical card or simply a soft or digital copy, in order to reduce the waiting time for the delivery of the so-called physical ID. Digital IDs can already be used. Also, the DSWD, through the 4Ps and the operations cluster, we are currently working with PSA to have all its beneficiaries to have their PhilSys numbers or the PSNs for an accurate, efficient, and transparent registration, identify verification, and enrollment processes amongst its programs through the establishment of a unified beneficiary database. This shall eventually enable the DSWD to implement a policy that shall enable the beneficiaries to register for a welfare program online, enroll, and update their preferred transaction account in a convenient manner. Let me also take this opportunity to encourage everyone, especially our beneficiaries, to register under the PhilSys so that the first step, which is authentication, is already done. Hence, we can efficiently provide the programs within minutes and within the day, like in other countries in India. Also, recently, the agency has partnered with Land Bank to convert our beneficiaries' cash cards into transaction accounts. This is in line with BSP National Strategy for Financial Inclusion, as these transaction accounts will offer a wide range of financial services, allowing our beneficiaries to safely store, send, and even receive money. During the pandemic, 4Ps was able to quickly deliver the social amelioration program, since almost all the program beneficiaries have their cash cards. So that was only cash top-up deposited in their respective accounts. With regards to the ineffective beneficiary targeting system, we are hopeful for the completion of Listahanan 3, or the National Household Targeting System for poverty reduction this third quarter, and that DSWD will be able to rightfully target better as to who really needs the help or assistance. And finally, we are thankful to the World Bank for its continuous support, especially the beneficiary first project where digital transformation is already in the pipeline. Thank you.
Thank you so much, Asikreya, for those updates. And I particularly take note of your call for everyone to register to PhilCs to make things easier for the programs. Let me go back to Mr. Junjay. Local and national level linkages are crucial in gathering and consolidating information from beneficiaries to enhance program delivery and assessment. While it will be helpful to digitally record and transmit compliance information of beneficiaries from the barangays to regional offices, many areas still rely on manual recording of data and paper-based submission of information. How could we support digital collection and transmission of data and overall digital access, especially in remote areas?
We are familiar with we are very familiar with its better manual practices in communities now in our work with community-based organizations now. And the pandemic has actually forced our mutual microinsurer members to use available technology as a response to challenges, for example, in mobility and mass gatherings, due to community quarantines, and do some substitute for paper and money-heavy transactions. So for example, the use of Messenger and Zoom applications for e-Kumustahan programs, which used to be a face-to-face activity, between the staff and community members, and also the use of Messenger for submission of claims documents, which used to be hard copies from communities down to the head office. And the use of e-money also and payment systems for paying and accepting claims payments, which used to be payments made in cash or check. But then again, we need to improve really on connectivity and having data capture platforms that have offline capability, like what we're doing with the mobile apps that we are developing for our member mutual microinsurers. Also, I think on the awareness side, and really in trust building, these are critical factors for any program, along with having local advocates also in communities for example, for the national ID system.
Thank you so much, Mr. Junjay. Your point on trust and trust building in communities, I guess, is very important in building these access to these services. Asik Peñaflor, the implementation of the Supreme Court ruling on the Mandanas and Garcia petitions will result in the devolution of some social welfare services to local government units, such as Kalay Seeds, SLP, Comprehensive Program for Street Children, and assistance to persons with disabilities. Does the DSWD have monitoring and evaluation mechanisms to ensure that these programs will meet their intended objectives once their implementation is transferred to the LGU? How are LGUs being capacitated to handle these programs?
Yeah, first off, the national standard still lies with the SWD, so that's the first one. And there's the proposed DSWD, DILG leagues, DBM, JMC on devolution, as well as DSWD devolution transition plan, covering the DSWD's MNE and capacity building mechanisms. The DSWD shall ensure that a results-based MNE system shall be in place to ensure the purposive conduct of monitoring and evaluations by the agencies concerned, and to guarantee that the LGUs have assumed and devolved the functions and services effectively in support of good governance, transparency, accountability, and evidence-based decision-making. Some of these MNE mechanisms identified are the Harmonized Planning, Monitoring and Evaluation System, or the HPMES, to ensure that these devolved programs and services are continuously monitored and that LGU's performance are assessed in their undertaking of the functions, and the conduct of program implementation reviews and quarterly meetings with partner stakeholders. Meanwhile, to prepare the LGUs to handle the SWD's program, the DTP, our Devolution Transition Plan, provides the LGU implementers and our partners of an orientation to generate their commitment and involve in the project implementation, case management, MNE training, and the conduct of empowering learning sessions for the Indigenous People Initiative. For example, the Sustainable Livelihood Program has 3 main information systems, or IS, used in the monitoring evaluation and assessment of the program, namely the offline baseline system or the OBS, the offline monitoring and assessment system, because this is always the challenge, the areas where they do not have internet. No? So that's why we already thought about that. And the SLP, Levied Assistance Grant Information System. So in order for the LGUs to be capacitated in handling the program and its intricacies, the SLP and NPMO PSMES is currently conducting a series of capacity building activities such as trainings and refreshers with the RPMOs, no, in our regions. Those are the regional program management offices, on the encoding process and the SLP information management system. So basically, the programs are doing parallel sessions and capacity building activities. I'm just giving one example. SLP is also being developed starting this year, no? And it will be as per the EO of former President Duterte. It should end at the end of December 2024. So in turn, the RPMOs will cascade the tools and information system to the local social welfare development offices once the full devolution occurs. So basically, we will still be here. The SWD will provide technical assistance. We will continue to monitor, but because that is our mandate as a central government, as a national government agency. Thank you.
Thank you so much, Asik Rhea. To Dr. Nash, the benefits of improving efficiency and adaptiveness through all these measures discussed are clear. Asik Rhea mentioned some M&E activities that they are doing in this WD. However, we know that quantifying the magnitude of the economic and social benefits may not be very easy and straightforward. How will you measure the efficiency gains or benefits from having adaptive social protection?
Thank you so much. And yeah, I agree. And I'm glad to hear that DSWD is really investing in capacity building for M&E. And I think it's quite important to include that because we know that, we need to really improve adaptivity, especially now that we've seen this in the pandemic as well. We know that poverty is not static and shocks happen, and we can see this quite clearly. There are people who move in and out of poverty, and this movement can be a reaction to shocks. It may also be useful to consider, what programs are appropriate for different people, given the context, and understand heterogeneous effects of various programs, and design programs accordingly. At the same time, it's important and key to integrate policy questions that decision makers have about these social programs, whether at the national or subnational level, and create a plan for learning that is integrated in M&E plans. And going beyond measuring progress towards output goals, it would be useful to address evidence gaps through impact evaluation. So in order for us to really measure efficiency, we really have to understand whether programs are achieving impacts, right, in terms of the outcomes that we set out. And thinking through impact evaluations in a strategic way and integrating cost effectiveness analysis in these evaluations can help us understand the efficiency and benefits of adaptive social protection programs. And yes, and as I mentioned, we're very happy to hear that DSWD is really building M&E capacity. We've been working with DSWD for several years now on M&E as well. And I think it's very important to consider really the capacity of LGUs as well for M&E as they are transitioning to the Mandanas ruling as well.
Thank you so much, Dr. Nash. I take note of the need to include cost effectiveness analysis in impact evaluations, among others. Let me have another round of questions for our panelists. Asik Rhea, we have the PhilSys Act enacted in August 2018 and an executive order issued in March 2022, mandating all government agencies to accept a PhilID card and PhilSys number as sufficient proof of identity in HN transactions, as you mentioned earlier. What would adopting PhilSys mean for DSWD's programs, and what would it take to make that happen? How is DSWD facilitating 4-piece beneficiaries registration in the PhilSys?
Thank you. So we are in the exciting times right now, sir. And in our department strategy, in order for us to improve social protection delivery systems, one of the mechanisms that DSWD has identified is the increased use of digital technologies and resources, which would integrate the PhilSys into its system and processes. So that's a continuous, let's say, work in progress that we have with PSA in partnership and with the support of World Bank. The department has signed a memorandum of agreement with PSA last September 20 of last year for the PhilSys pilot use case, and this covers the pilot of PhilSys API-enabled authentication services to verify the identity of potential beneficiaries in the registration of 4Ps beneficiaries and the screening of assistance to individuals in crisis situation, or the AICS beneficiaries and clients. No, AICS, of course, this provides, especially during the pandemic, medical assistance, burial assistance, transportation assistance, all those kinds of assistance that is provided to the vulnerable individuals. So the use of PhilSys for identity verification aims to remove the need to present physical IDs. So PhilSys will serve as a gateway for all the SWD programs to have a more accurate, efficient, and transparent registration and enrollment processes, and to have a mechanism by which it can cross-check information on its beneficiaries with information systems of other government entities. Basically, it's two steps. So at least if you have you're registered with PhilSys already, you are already authenticated. You're saying who you say you are, so that's already done. Then we will already pay, since we will check the eligibility, and so our beneficiaries will no longer go back, spend another time, because that's also another risk and another vulnerability. So we are excited with this. And to facilitate 4Ps beneficiaries registration in the PhilSys, the SWD promotes and encourages our 4Ps beneficiaries through social media platforms to register for PhilSys. The SWD also initiated partnership with PSA to prioritize the registration of 4Ps beneficiaries in the BARM, Bangsamoro Autonomous Region in the Muslim Mindanao, with the objective of leveraging on the PhilSys to address challenges of beneficiary data fraud and duplicates. So the Ministry of Social Services and Development, the Ministry of Interior and Local Government, the PSA BARM are working together to conduct the PhilSys registration through clustering or going to the barangays. Thank you, sir.
Thank you so much, Asikreya, and exciting times indeed. Congratulations on your good news on your MOA with PSA on the verification for AICS and 4Ps. For Mr. Junjay, the experiences in other countries show that having foundational ID can greatly enhance financial inclusion and financial market development. What role should the financial sector play in catalyzing the use of PhilSys for people's access to financial services?
I believe the financial sector can make a difference in this area through the use of its social distribution network to educate and promote, for example, the national ID. Particularly in the microfinance and the microinsurance sector, as we bring financial services into the villages, it may be good to explore the possibility of utilizing the already established community networks as a venue for promotion and education. These community networks actually meets for 1 hour a week, as a venue for doing financial transactions and continuing educations for the program of the MFIs and mutual microinsurers. And so just imagine the impact, in our sector, particularly, if we have more than 7 million members nationwide, and this can actually translate to 7 million households and about 32 million individuals that are educated and on the benefits and use of, for example, the national ID. And there is a mutually beneficial interest here, because the microfinance and the microinsurance sector, the national ID, for example, will simplify their know your customer requirements for these KYC requirements, as new clients and policyholders are required to submit a number of KYC documents to be enrolled in the programs, and also for doing or for claiming insurance benefits, for example. So I think there's a mutually beneficial use now for both the government and the financial sector in this regard. Thank you.
Thank you so much, Mr. Junjay, for highlighting the use of PILCs in KYC requirements of financial institutions. And finally, Doc Nash, when PILCs is discussed, very common questions include, where's my card? I have been waiting so long. Well, me, I personally don't have my card yet, but, or why is there no signature on my card? Or I already have so many IDs, why bothering getting another ID? However, the benefits of PILCs is that key information is linked to your biometric information. Thus, technically, as mentioned by Asikaya earlier, it doesn't require the physical card or signature, and it's not just another ID. You have led many innovative research, including on behavior change in developing country settings. How would you go about changing this mindset?
Thanks, Doc Mike. That seems to be a very complex question when we're talking about mindsets. Of course, there's no sure way of influencing mindsets. It is important to understand behavior and understand the incentive behind people's choices, understanding their constraints. It may be different for people who are in urban settings where they're near registration sites or rural settings where it could be farther. We know that there are many benefits to PILCS registration, and we want to encourage and increase take-up and for people to actually register. This could mean thinking through ways to improve communication of the benefits of PILCS, improve the program rollout in order to address people's concerns and lack of understanding regarding the new ID system, and then potentially developing behavioral nudges to encourage take-up and testing what works and what does not when it comes to that. Now, we've seen some success of behavioral nudges in many other sectors, whether it's financial behavior or health behavior, such as SMS information campaigns or providing posters, brochures targeted to a certain demographic. These can be affordable alternatives that can be impactful when done well. And it is very important to incorporate evaluation learning in this process so that we know what really will help us achieve our goals.
Thank you so much, Doc Nash. What I gathered is that it's quite difficult. You need to identify specific subpopulations for interventions. Well, I would love to ask our panelists more questions, but unfortunately our time for the discussion is up. Let me thank our panelists, Asikreya, Doc Nash, and Mr. Junjay, for their wonderful discussion and insights that they shared with us today. And now it's time for our open forum, and that's a good thing. Our panelists will be joined by our two presenters, Dr. Orbeta and Dr. Cho. We will also be joined by field experts from PIDS. We have Drs. Jose Ramon Tuts Albert, Connie Bayudan Dokikoy, Cristina Tina Epetia, Sonny Domingo, Margarita Maggie Debuque Gonzalez, Valerie Gilbert Val Ulep, and Aubrey Tabuga. We're ready to entertain questions for our panel, our two presenters and our field experts from PIDS. But before I read your questions, I'll use my moderator prerogative to ask the first questions to Dr. Orbeta and Dr. Cho. Well, we have introduced many new entitlements over the last decade. You've mentioned many of these. So we have free tertiary education, technical education, we expanded basic education, we give free social health insurance coverage and free old age pension, among others. Can we afford these programs in the longer term? Can these programs pay for itself through indirect channels, through productivity perhaps? How should government balance a trade-off between fiscal sustainability and program generosity? Dr. Cho?
Thank you so much for a very, very challenging question. There's no one-line answer for this difficult question, and the fiscal constraints in light of the current situation with war in Ukraine, the looming global recession, and government has spent quite a lot during the pandemic. So, the fiscal constraints and limitations will continue to be a key issue. For the social protection programs for the most vulnerable population, like social pension for indigent elderly or human capital investment, like a 4Ps program, all these necessary and important programs should go on. At the same time, in light of these fiscal constraints, making sure that the social protection programs are productive and social protection programs are well targeted and it doesn't have any leakages or inefficiencies is going to be very important. So for the productivity, Dr. Abreu, you mentioned the labor market interventions, especially the programs that are targeted for the working age population who are able-bodied, who can work, encouraging productive activities is going to be very important. For the poverty, anti-poverty programs, having the solid targeting mechanism and improving targeting performance, as I presented earlier, is going to be very important for fiscal efficiency. And then third one is going to be the reducing administrative cost and improving the delivery efficiency is going to be very important for this environmental with fiscal constraints. Thank you.
Thank you so much, Dr. Cho. How about you, Dr. Orbeta? What are your insights on this?
Thanks, Mike. Difficult question indeed. Usually I go back to principles like in giving free programs to and fiscal sustainability is an issue in many. It's not an issue in the short run for if you have a disaster, you have to help people, and but that's why I mentioned about short-term and long-term issues. You have like we have what we have been doing is like using syntaxes to pay for pensions, for indigent programs, and all of that. And I think if I can remember correctly, most public finance people would not like directed financing because it constrains the resource allocation, the general resource allocation of our fiscal managers. But that's I think working, and people seems to be agreeing to that we can use syntaxes to pay for general programs. What I'm concerned about is when you provide, like for example, free rides to people in Metro Manila using general taxes. That's not that's over the long term. That's not sustainable. You can't give freebies to a specific group of people and generating taxes from everyone. So the principle is always use general taxes to pay for general benefits. Don't pay for like, for example, the other one is free tuition for people who go into college. There are of course public good components of that, but in general sense, you cannot be using that. That's why we are always we like that the user fee method is like toll fees is a very effective way of financing. When you use it, you pay for it essentially because you benefit from it directly. So the balancing is always a political decision. The balancing between who pays and who benefits is a very tricky issue, and that should always be a principle that we should have in our minds. We should not be just giving benefits to a specific set of people like in Metro Manila because they are noisy, and depriving when we use general taxes, which comes from everywhere. So that kind of principle, I think, illustrates a lot about how we should think about financing certain programs. But of course, in disasters, you have a generic. Maybe in the short run you can do that, but the principle has still to be. But that specific you target specific user fees is always the best way to pay for specific benefits for specific people rather than general taxes. That's I think the most I can say about these difficult questions that public finance people are facing.
Thank you so much, Dr. Babes and Dr. Yoon, for your insights on this difficult question, highlighting the tension of generosity and sustainability. Now, let me go to our Zoom chat box and Facebook Live questions. We have a few here. Let me direct these questions to Asikrea and to Dr. Toots. These are on senior citizens. There are various policy proposals to provide universal social pension to senior citizens, not only to those who are indigents. What are your thoughts on this? And a related matter from Daniel Agustin on poverty alleviation. What are your recommendations on how the senior citizens can be employed? Asikreya, please.
Yeah. Thank you. So by virtue of RA 11350, the National Commission of Senior Citizens, or the NCSC, is already created under the Office of the President. The Commission is mandated to ensure the full implementation of laws, policies, programs of the government on senior citizens, review it and conduct related studies, and recommend policy to Congress and to the President. So if there will be a law passed on this, we welcome this, and to provide for a universal SOCPEN, no, not only for the indigent, so long as we have funds to support the mandate. So we would love to have a universal social pension. Again, the department, or for example, if it's going to be NCSC that will already be implementing this, will just implement so long as the funds are available. Thank you.
Thank you, Asikreya. Sir Toots?
Yeah, well, I'm not too keen about universal social pension for, elderly, everybody, because to be quite honest, I'm as a statistician, I always say, what's currently being done by the SWD is as per the law, the social pension is for indigent elderly. The only problem is I think the SWD has not been consistent with their definition of indigency, because when you think of indigence, that means poor. But unfortunately, our evaluation suggests that they may be actually being given that pension may actually be also be given to some who are not poor. But that being said, I think you could relax the definition of indigency to be low income, and my definition of low income is twice the poverty threshold, which is it's a good way to sort of think of at least helping much more than the poor, because currently the poor among the elderly is just much fewer than what they are currently giving. Now, DSWD's social pension is already costing about 23.5 billion pesos, okay, per year. And if you are going to expand this to all elderly, this will cost between, my estimate was something like between 115 billion to 140 billion pesos. And that's a lot of money. And so where are you going to get that? And as pointed out by Dr. Orbeta earlier, it's one has to be, I mean, if you have all the money, well and good, but if the question is, do you have the resources to actually give to everyone? And so you have to start thinking really carefully that you give to only right now who you can afford to give. And currently, I think it makes much more sense, and I have made this suggestion even to Congress. Don't just double the budgets. Currently they're giving 500 pesos per month to all the SOCPEN beneficiaries, and they want to double it to 1,000, which is reasonable. But my question is, who do you give it to? Because currently I don't think they're giving it to everybody who needs it. Some people are actually getting it and they don't need it. So it's a targeting issue, it's a financing issue, and so one has to be a little bit more careful about making these decisions. Of course, at the end of the day, it's a political decision.
Thank you so much, Sir Toots. We have a rejoinder from Asikreya.
Yeah, may I respond to that? Of course, as per our memorandum circular 4 of 2019, we listed the criteria as to who are considered indigents. So these are 60 years old, no, senior citizens as per our law, who's frail, who's sickly, who's or disabled, or has a disability, and does not avail, or no pension from the GSIS or any other insurances, no permanent source of income, and no regular support from the family or relatives for his or her basic needs. So we'll from the observations of our fellow here, I will I will also raise this concern to our statutory programs group. Perhaps there's a need to review this memorandum circular. No, so on our part, again, we will implement as per the law. If ever there's a budget, then if it's universal. But of course, with the looming crisis that we have, we need to also prioritize the funds that we have for the national government. Thank you.
Thank you so much, Secretary, for the proactive response. These questions now are for Drs. Val and Au from PIDS. This question is from Mr. Abner Manlapas. Did PIDS study the impact of disability-related expenditures to poverty amongst persons with disabilities and their families? He noted that disability-related expenditures are major drivers of economic hardship faced by persons with disabilities. The costs include medical supplies, medical-related services, assistive products, sign language interpreters, and others. What's your take on this, Dr. Au and Dr. Val? Dr. Au first.
Yeah, so hello. With regards to whether we have the study about the impact of disability-related expenditures to poverty among PWDs, I'm afraid we don't have that. What we have done in the past is to analyze the livelihood of persons with disability, and definitely, if you look at the expenditures that they spend on their whatever, all those assistive devices that they're using, definitely if these are families from lower income groups, then that can really make them poorer. And so but we don't have those studies for a representative parts of the population. In fact, I think we don't even have the extent of poverty among PWDs, and it's something that we need to do in the future in our surveys. I think the other questions or comments can be addressed by Val. Thank you.
Thanks so much, Dr. Au. And I take note of your call to have these estimates for persons with disabilities as well. Dr. Val, I know that you have a study on catastrophic health spending, which is a related matter. What's your view on this?
So I think, thank you, Mike, for that question. I think one of the most interesting patterns that we see in catastrophic spending is if you look at the Family Income and Expenditure Survey from 2012 2018, it's actually declining. And one of our hypotheses of the declining catastrophic spending is perhaps the increasing public spending, right? Increasing, when you say catastrophic spending, this is because a lot of people are using out of pocket, right? But from 2012 to 2018, we see decline in catastrophic spending based on our unpublished analysis. And one of our hypotheses is the increase in public spending, perhaps due to sin taxes. So we need to do more analysis on that, but there is an interesting patterns that we are seeing in terms of catastrophic health spending. And with regard to the question on what's that disability, I think it's one of the areas that needs more research. As I think mentioned by Dr. Tabuga, you have a very limited empirical analysis at PIDS, and it is an area that we need to focus on.
Thank you so much, Dr. Val. This question was addressed to Dr. Orbeta by Daniel Agustin, but I guess I'd also call Dr. Maggie Dibuque for this. Dr. Daniel Agustin said, it appears that our social protection programs are initiated at the central government. With the Mandanas ruling, should LGUs initiate social protection programs that focus on their situation?
Okay. Well, actually, this is something that Dr. Sikat can answer, but on principle, yeah, we have to be mindful, of course, of the bottom line, which is the fiscal balance. And if you are going to have a larger portion allocated to the LGUs, then there should really be a rebalancing. As to how this should be done, I think Dr. Sikat would be more in tune with what's happening on the ground. Thank you.
Thank you so much, Maggie. Dr. Orbeta?
I think she was talking about Dr. Sikat. Yeah. Dr. Sikat is better.
Yeah.
Yeah.
Yes, thanks.
Unfortunately,
Justine,
Just
not
here.
I'm
Dr.
here.
Jerry
I'm
Sikat,
here.
Justine Sikat. Okay.
You're here. I'm
I
sorry.
have been
You're,
here since the start. Yes. Hi. Good.
sorry about that. I should be calling you. Yes, Justine.
Okay.
Yeah. That's fine. That's fine. Justine with an E. So in any case, good morning, everyone. Yeah, I actually also responded to Daniel Augustine's question, and his question was with the Mandanas Supreme Court ruling implementation, whether LGU should be, should implement social protection programs that are more specific to their areas. Ever since the 1991 local government code, they have been given the authority to identify this. And if you look at the data, they do already have programs that are specific to them. But as Asek Rhea mentioned earlier, the DSWD also has a devolution transition plan, identifying the programs, which also Doc Mike mentioned earlier, would be redevolved or given to the LGUs. But um, in my opinion, as a matter of principle, I think that the larger redistributive programs, such as the 4Ps, should for now still remain with at the national government level, just because they would have, a broader perspective and scope, especially with regards to getting the budgetary support that is needed for these programs. But definitely, the LGUs really do have the authority to implement their own social protection programs. So thank you very much.
Thank you so much, Justine. And I'm very sorry I didn't notice you in the list. But let me put this question to Asik Rhea. What would be the dynamics be between DILG, LGUs, and DSWD in having these programs at local level?
Yeah, we have actually a JMC with them in the implementation. So even before the executive order was issued by the president, we've been working with the DILG because, of course, they are the one, it is their mandate to supervise these local government units. And I'd like to also rejoin our fellow earlier, Ma'am Justine, saying that it has, the local government code has been there. It's just devolution 2.0, if we can call it, really explicitly saying in the Mandanas ruling and the executive order of the president implementing it. So on our part, for the departments, not just DSWD, we continue to capacitate our local government units in parallel, and at the same time we've done it even before the devolution 2.0, no? So at any time we are open, especially in the institutionalization part, where it should be cascaded through like League of the Mayors, etc., so that everything, especially the operational manuals of our programs, are also easy to access for them. So we are prepared, and we really hope that the local government units will also prioritize and place all this in their work and financial plans, including the personnel, because I've seen some questions, because I've been busy answering also so many Q&A questions on the side here in Zoom. I think our time is really short in this webinar, but please feel free to contact anyone from the DSWD and we have clusters. We have clusters to respond to all this. If it relates to statutory programs, we have a subcluster on that. If it relates to specialized programs like 4Ps, Kalahari Seeds, and SLP, that's on me, specialized programs. But let me reiterate also that 4Ps will not be devolved. Okay, so it has been institutionalized. It is we have the 4Ps Act or the law, and it says that it's with the DSWD, so that it's clear. So no need to worry for our fellows and the other and our fellow Filipinos. It's going to stay with the DSWD. Thank you.
Thank you so much, Asik Rhea, for that assurance that 4Ps will stay with this WD. Dr. Yoon, what's your take on this?
Yes, I have 2 cents to add about the Mandanas ruling and decentralization of social protection programs. As earlier speakers mentioned, nationwide flagship programs like 4Ps being implemented at the central level, and some other programs to complement devolved into the local government unit is also very good. And LGUs coming up with their specific programs for addressing their specific needs is also very good. But I just wanted to highlight decentralization of social protection programs doesn't mean that each LGU has to reinvent the wheel over and over. If you recall, during the pandemic, when the contact tracing was very important, certain LGUs, high capacity LGUs started building their own contact tracing app. So if you want to move from Makati to Taguig, you have to use different apps to provide the contact tracing information. So it is better than having no contact tracing mechanism, but utilizing common platforms and common infrastructure is going to be very important for all the high capacity or low capacity LGU can take advantage of certain platforms. And there is the central government's role to play, including the the field system incorporation or digital payment mechanisms or data management systems or digital payment mechanisms or targeting mechanisms. You don't have to, reinvent the wheel over and over at LGU level, but, having the common systems at the national level is going to be very important.
Thank you so much, Dr. Yu, for highlighting that there's no need to reinvent the wheel, and we can use common infrastructures and platforms. On a related note, we have a few comments about interoperable data. So we have comment from Jonathan Marskel. The absence of interoperability of databases severely constrains the ability of the national government and LGUs to properly target and deliver social protection. Glad to see this highlighted. We have comment from Nalp Aseo. The problem is outside of an interoperable data system, coming up with the data itself is difficult, requiring significant time, money, and expertise that LGUs and regional offices just don't have. And from Nympha Villamayor, every time a social program will be implemented, the proponent always have to gather socioeconomic data and demographic data of the area. The LGUs should be equipped on data gathering and database management of their barangay. I have follow-up questions to Dr. Nash and to Dr. Toots. To Dr. Nash, based on your experience and on what you know of the field about cooperation among communities, among government agencies, how can we bring these agencies together to work on this specific goal? And to Dr. Toots, can you speak about the problems, the issues that local governments have about gathering data, not particularly for this, but for other endeavors as well, based on your experience as a former head of the NSCB? Let's start with Dr. Nash.
Thank you so much for that question. I think there's also no one answer to that, but I think several comments already mentioned earlier was highlighting the important factors that we should consider, such as resources, right? Not everyone has the resources to really put together a good database. We need capacity. We need to build capacity as well. And that includes assigning personnel, right? Key personnel at the subnational and national levels to really focus on data. And as we mentioned earlier, now that we are working on PILSIS, that could be a good starting point that people would be able to access and be able to use that as a more interoperable data management infrastructure. But I think one thing that I would also like to add that was not mentioned is really, looking into the Data Privacy Act and access to the data, right? And so, what are the constraints that people are facing in order to access data, and who is covered by that? Like if you're working with subnational or local government units and the national units, are they able to access data from, for example, the national level? And so that's also an important question to address.
Thank you so much, Dr. Nash. Dr. Toots?
Yeah, thank you very much for that question. It's a very loaded question, and as Dr. Nash was already pointing out, as a starting point, the issue is partly capacities for local governments. We've said, okay, let's decentralize, and but the only thing is they don't have the capacity. They're not experts on data collection. They have no experience on that. Are starting to build up with community-based monitoring systems, and I'm glad to some extent that the PSA is now going to be something like a supervisor of the CBMS systems. But the problem still will remain, and I think that was pointed out also regarding this Data Privacy Act, which seems to be another barrier for institutions to work together under whole of government. We keep using that term. I hate that term actually, whole of government, because we keep saying, okay, let's cooperate, let's coordinate, but there's no coordination happening. There's no data sharing happening because many institutions are afraid to share data with each other. For fear that they may be imprisoned or something, when actually the issue really about data privacy is accountability. Now, I would really want to have a system. In fact, data privacy should not be an issue because even in Statistics New Zealand, which is probably the best kind of practice ever across the world, together with some other institutions in some other countries in the West, very rich countries, they have not just interoperability, but in Statistics New Zealand, they have a data infrastructure where anybody can do household surveys, whether local governments, even academic institutions, but they throw it all to the Statistics New Zealand, and Statistics New Zealand just merges everything by way of a national ID. So in theory, it could be done using the national ID as a way to merge information. So that's the way to do it. However, we're still a long ways from doing that, partly because we don't want to cooperate. We are using the Data Privacy Act as a way not to share information. We're like like librarians. We collect data, but we have to store it somewhere, and we're not going to share it with anyone because this is mine. And so we're kind of screwed up. We have to start recognizing that there should be an enabling environment where capacities are good, but at the same time that we cooperate, and we're still a long ways from doing that, unfortunately.
Thank you so much, Sir Toots, Dr. Albert. These next set of questions is about coverage of social protection programs, and I'll ask a number of you to answer this. First is for Dr. Ulep. This is from Peregrine Cayadong. On the challenge regarding actual coverage and efficiency, maybe we need to look back on the following. What's the level of advocacy campaign to improve health-seeking behavior among Filipinos, especially the poor? What is the past and current level of effort of our health service delivery units, RHUs, which operated hospitals and private hospitals, in responding to health service needs of the Filipinos with emphasis on the poor? And the next one is for ASEC Rhea. This is from Hideki Kagohashi. Is there an integrated monitoring system of the beneficiary level impact on a broad range of social protection programs supporting the recovery of the calamity-affected population? Any system of one program would not be sufficient for the purpose. And the last one would be for Dr. Orbeta and for Dr. Cho. Are there existing empirical evidences that demonstrate that adaptive social protection improve the productivity of poor people, particularly those that are CCT grantees, more particularly those that graduated from a program and those that are about to graduate? Let's start with ASEC Rhea.
As I said earlier, we have the UBID, Unified Beneficiary Information Database, and it's supposed to address that, the question that you said earlier. And of course, even before, we even would like to have like a geotagging style where we know where the beneficiaries are, what social protection programs they have already benefited or they have accessed from the department, etc., so that we know the vulnerability, we'll be able to see trends. So this is something that we're still, it's a work in progress, especially that these are programs in different clusters. These are statutory programs, then you have the specialist programs, but of course, and of course under the DREAM-G, disaster risk management group, But we would like to have a whole, what do you call this? We would like to look at it wholly, so there, we will, of course, I do not have the data now, but it's something that we're doing, especially with our database and under our ICTMS. So basically, that's what I can share with our participants in this webinar. Thank you.
Thank you so much, Asik Rhea. Dr. Ulep, on coverage.
Okay, thank you, Mike. So I think regarding the access to healthcare, there is a large disparity in healthcare access in the Philippines. And the reason why we have that could be categorized into two large. Number one is supply, and the second is demand, right? So when we talk about demand, there's a huge difference in health literacy among the population, right? The richer population would have better health literacy, and the poorer ones would have very low health literacy. And the second one is actually supply, right? There's like maldistribution of health facilities in the Philippines. Even if you have demand, but you don't have supply, you have problems with that. So based on our analysis, for example, 50% of our population do not have access to rural health units in a timely manner, right? So the problem with healthcare utilization and it will somehow impacted by coverage is because of these different factors that could be categorized into supply and demand that we need to both address, right? So I think that's my response to that.
Thank you so much, Dr. Ulep. Dr. Orbeta?
Okay, I think the question is about effectiveness of adaptive programs. I'm a little bit confused of what that means. So let me try to, if that means about response to climate change or environmental hazards, that's, I think, one literature of adaptive responses is like that. I would like to throw that to Sunny, our DRRM expert. But before that, maybe one interpretation of the question was about whether we have graduation interventions, or what are happening to graduation interventions to, let's say, purpose beneficiaries, which we have a little bit of research I've been doing, trying to, and as you know, and Asik Rhea can say as well, that the Sustainable Livelihood Program is supposedly the graduation program of purpose beneficiaries. That's the nature of the adaptation that you're saying. And from our analysis and the data that we have, still learning and learning the ropes of how to effectively, because it's not helping the ultra poor move out of poverty is not an easy issue, because if it is easy, it has been solved long before. As I already mentioned, that the thing that has somehow consistently produced positive results is the multi-intervention programs, or so-called graduation programs, where multi-interventions are together, because of the realization that the ultra poor faces a lot of they don't just are not constrained on financing, but in many things, even the capacity of using finance and all of that. And you have to handhold them, you have to protect them from consumption shortfall, because if you don't do that, they will eat whatever is they have borrowed, and they cannot be paid anymore. So essentially, that's the essence of the multi-intervention program that's working in many countries. So I'm glad, as I mentioned, that we have been experimenting on that in the country with the help of ADB, and I think DSW is also involved to recognize it. Some of these single intervention program works in specific sectors, but not for the ultra poor, who is facing several challenges. So that's my take on that, and we need to learn from that, and so that we will have a more consistent way of. I think many of the development partners who are helping ultra poor have realized this, so they have expanded. And one thing that I would like to emphasize is that our social protection framework recognizes convergence programs, but it's just a term, convergence. How do you do convergence is another thing. So I think that should be knowing what risks the poor are actually facing and addressing each and every one simultaneously is a very important realization that we have in working with ultra poor communities, so that they can you can move them really consistently out of poverty. I think that's my take, and I don't. Asik Ray has raised his hand, and I think that if you want a response, I don't know if you want a response for adaptive methods. We can you can ask Sunny to respond on what's happening in that area in terms of climate change and environmental hazard vulnerability. Yeah, thanks, Mike.
Thank you so much, Dr. Orbeta. Before calling on Dr. Cho and Dr. Domingo, let me call on Asakaya first.
Yeah, let me quickly rejoin what Dr. Orbeta said on the part of convergence. Right now, we are implementing the Padayon SLP. This is a graduation pilot project that Sir Orbeta was referring to, and we will finish. We're set to complete this year, and this only covers around 3,000 beneficiaries, and these are 4Ps beneficiaries of level 3 improvement of their well-being, meaning to say they are self-sufficient, but that they are about to exit the program, and so we need to prepare them. And there are programs that need to be used, interventions, and we looked at SLP as the intervention. And for the result in the future, I'm sure we will be needing PIDS on this to check and to measure as to the impact of this pilot program. And then after that, we can already propose to our Congress that there is a need for them to fund this program in relation to 4Ps, as an intervention, so that we will minimize the risk of these of poverty or the ultra poverty. And we would like to thank ADB in partnership with DFAT for also partnering, counterparting in this project, with Asian Development Bank and BRAC. So there, and we are excited as well that this will be institutionalized in the future, as this is the first time that we did this, especially that sustainable livelihood program will soon be devolved. Thank you.
Thank you so much, Asikaya. Dr. Cho?
I'd like to think about adaptive social protection in a broader terms, not only disaster response or small-scale intervention, but also getting households prepared and resilient for future shocks. On these two dimensions, I think 4Ps has been kind of fantastic example in the country. When it comes to disaster response, earlier we highlighted a lot on, digitalization, business process streamlining, so that, government has to respond quickly and effectively. So 4Ps, these are payment mechanisms, or their solid database mechanisms had proven to be very effective during the pandemic. The social amelioration program distribution for 4Ps beneficiaries has been very quick. And it was not the first time that 4Ps has been instrumental in the disaster response during the Typhoon Haiyan as well. At that time, 4Ps beneficiaries were able to receive the government subsidies very quickly. So this adaptiveness of response, 4Ps has been great example, and expanding this kind of good practice beyond 4Ps and other programs and other localities and other cases is going to be very important. Going to the first part of getting households better prepared for future shocks and building resilience, also 4Ps has been very good example in building productivity of future generation. Investing in children's health, nutrition, and education has been very important, and it has paid off quite a lot. Initially, when the primary schooling was struggling in early period of 4Ps, 4Ps has proven to be very effective in encouraging primary school education. Now it is almost universal. 4Ps program has been very effective in encouraging kind of secondary and higher education. So on that productivity side, very encouraging finding. The only thing that I wanted to highlight about 4Ps going forward is really going back to the fundamentals of the initial design of the program, health, nutrition, education, and going forward to the graduation and productive life. Health and nutrition particularly is struggling a little bit among 4Ps because there are very few pregnant women and young children are currently benefiting from the programs. Very good design for health and nutrition intervention, but very few eligible beneficiaries who can benefit from them because of the lack of dynamism in targeting system. So that's the only concern. And the DSWD is working hard to address the challenges. So going forward, adaptive social protection is very important, and Philippines has good examples, and that can be expanded to other programs as well. Thank you.
Thank you so much, Dr. Cho. Dr. Domingo, how are DRM policies important in adaptive social protection?
Yeah. Thanks for that, Mike. Well, from the inputs from our panel members and resource persons, we can actually divide adaptive response in 3 levels. One is national, second is subnational, including our LGUs. And then the third one, as Dr. Cho mentioned, at the household level. At the national level, we have umbrella legislations and national action plans determining our way forward institutionally. At the local government units, there are so many vehicles toward mainstreaming DRR and CC adaptive mechanisms. And we have that. We have those mechanisms and we have those grounding on a very arbitrary level. So when you talk about the Mandanas ruling, putting in more resources to our LGUs, we have to qualify whether the LGUs are capable of using additional resources as well as using them in an effective and efficient way. We've been mapping or back mapping LGU spending on DRR and CC for the past 5 years, and we have seen suboptimal utilization of such funding. So what more if we are going to input more resources to those LGUs, and with them still having those institutional limitations in terms of fiscal spending, and then eventually in the overall planning and investment programming. At the household level, you have interventions from the national government as well as the LGUs, and probably at the forefront would be our stakeholders within the local governments. But as Secrea mentioned earlier, the SWD for one has on the ground programs that look into household augmentations. You have your 4Ps looking at family development sessions, them also looking at resiliency and essentially responses to external shocks. So you have those levels, and probably going forward, we have to have a rational way of looking at institutional approaches, as well as us grounding policy. Resource-wise, we have to be more rational in terms of budgeting and spending. And what we have right now, we need to spend wisely. And that points toward LGUs being more efficient, being more optimal in terms of making better use of what they have right now. Because we've been hearing anecdotal inputs, saying that we need more resources down the lines, particularly among LGUs. But looking at evidence in their spending patterns, they have so much unutilized local DRR funding. And we can start with that. We can start capitalizing on the capacity building within subnational levels, and then actually using what they have right now going forward.
Thank you so much, Dr. Domingo.
Mike.
This next question is for Mr. Jun J. I hope you're still around. From Abner Manlapas, don't you think that financing is the main issue why we have a problematic social protection system in the Philippines? Because of issues on financing and targeting, we have huge hit and miss issues. It does not really take into account multidimensional poverty like the one faced by persons with disabilities, older persons, people with health conditions, etc. How are community level microfinance institutions addressing these gaps on financing?
Thank you. No, I think the purpose really of the establishments, of, for example, the microfinance NGOs is to address the failure of the market then to provide for rural finance, not to the low-income households, especially the women. In fact, a lot of these organizations are providing, for example, financial services. 90% of them are women. For example, in our network, before there were government credit programs, and later on, I think around 1998, this was rationalized through Executive Order 138, directing government agencies to stop lending programs and turn over to the private sector the function of providing credit services. Because we understand then that the study reported that government agencies are really good at lending but not in collecting. And of course, the mentality also of the people in the community, that when they borrow from the government, it's really the money of the government. So there's no obligation to pay. And in recent years, we have I think more than 2,000 microfinance institutions composed of NGOs, cooperatives, and rural banks who are now providing credit programs to a lot of rural poor, particularly. And what's good about this now is that if you access credit programs, there are already, you will also have access to affordable and relevant microinsurance programs and even saving services. So if we're looking at assisting micro entrepreneurs, we can look at the programs of MFIs and cooperatives. And when we would like to look at, for example, assisting the small and enterprises, we have available, for example, SME banks already, and I understand like Small Business Corporation under DTI is also providing support for financing for the SMEs.
I have a few more questions for you, Mr. Junjay. This is from Ms. Magdalene Hagit. What would be the best financing institution can you suggest to maximize the production and not to add burden to the loan? And second, from Ms. Rosalie Kilikol, what are the potential and shortcomings of microinsurance as a social protection mechanism?
In terms of the microfinance, as I mentioned, there are already available access from MFIs nationwide, and I think in terms of the sector to be served, so we're just looking at MFIs for the micro entrepreneurs, and then the SME banks, for example, and the small business corporation for those who are small and medium enterprises. In terms of micro insurance, I think we've grown in the last 10 years, and we've seen that it has already insured the last report from the Insurance Commission is that about 49 million individuals already. And particularly for our sector, we're serving about 7 million members, more than 7 million members, and we're because we offer family life insurance programs, we've been able to cover about 27 million individuals now. And in terms of, I think I'd like to go back also in terms of the problem before, why these mutual microinsurance organizations are formed, because before, the problem really of claim settlement, that the experience with the with the commercial insurance sector. And of course, before, the low-income sector is really invisible to the commercial sector, but now they've also seen the opportunity in doing business with the low-income sector. I think one very important factor that caused the success of micro insurance in the last 10 years is the addressing the problem of claim settlement. For example, as I mentioned kanina, we're really striving to settle claims within 1 to 5 days. In fact, one of the biggest micro insurer now, Card MRI, is doing like 99% of their claims paid within 1 day. So this is this has actually generated a good word of mouth in communities, and this also paved the way for other people in the community looking at microinsurance programs.
Thank you so much, Mr. Junjay. These next questions are for Dr. Epetia and Dr. Connie Bayudan. We know that employment is an important aspect of social protection. Do we have enough programs to support employment of the youth, women, and elderly, or do we actually want them employed? Dr. Bayudan first, followed by Dr. Epetia.
Hi, can you hear me?
Yep, I can hear you.
Oh, I thought you already forgot about me and Tina.
No.
Okay, so thank you for the question. Regarding it's good that you raise the issue of labor market, because most of the discussion so far has something to do with social protection in general, but in terms of labor market, because we know already that we have emerging forms of work, and it's really important that we recognize that there is a very huge gap in terms of providing social protection to this emerging workforce, which are considered independent contractors by the platforms. So if you are familiar with platform work, if you are not familiar with platform work is a new form of work that is facilitated by platforms. So platforms are mediators, and where workers they do not have employment relations. And just to emphasize that the people who are drawn to this platform work would be women. One would be women and the young. Women because of the flexibility that it entails, that the work entails, and young maybe because they are techy, technologically savvy, and all. So, and I'm pointing this out because as the young population may be naturally drawn to this kind of work, naturally there would be concerns pertaining to the erosion of contribution to the social protection base, which may lead to problematic gaps in terms of providing social protection coverage, not only now but also in the future. So this is something that that needs to be worked on, and I think that there is a need to expand the social protection program. I think that it has to be compartmentalized. There has to be a short term and long term expansion. In terms of the short term, we need to the stakeholders need to work with platforms in terms of they have to collaborate in terms of what is best, what can be afforded by the platforms, and what in terms of providing social protection to these independent contractors. In Malaysia, if I may share with the group, Malaysia is a little bit advanced in terms of providing social protection to this kind of workers, so these platform workers. For example, the Food Panda in Malaysia, they contribute to the partner share to the social protection contribution, and the Grab and GoGet also have similar programs, but that is something that is not yet observed here in the Philippines, and it's something that we can also look into in terms of providing social protection to platform workers. And then in the long run, in the longer term, maybe it's high time for us to consider amending the labor code, which is actually very dated. I think it's around 1970s. I'm not really sure, but maybe it's around 1970s, and it's really dated because now work has already evolved, and there are new forms of work arrangements that are not yet covered by the labor code, which actually something that can be integrated into the amendments. That's it for me, Mike. Thank you.
Thank you so much, Dr. Connie. Dr. Petia?
Thank you, Mike, for that question, and for Connie starting the conversation about social protection for workers. So as we've known, no, during the COVID-19 pandemic, there has been massive job losses. And it's the social protection for those who were involuntarily separated from their jobs is quite small if we're going to compare that with other countries. So there really needs to be an expansion when it comes to scope, number one, and number two, eligibility, because it's mostly just the formal workers who are covered by, for example, unemployment benefits, those who were involuntarily separated from their jobs. There were some aid given to even to informal workers during the disruptions caused by the COVID-19 pandemic, but they're mostly transient in nature. So what we can look at is to have a well-designed social protection system that will encompass all types of workers, just because of that increased precarity of work arrangements as mentioned by Dr. Dakuy. And then in the long run, there really needs to be that drive towards reskilling, and as well as increased training among workers, especially that the employment structure of the Philippines is leaning towards low-skill employment, which contributes to in-work poverty in the Philippines. So for addressing shocks, so encompassing social protection, and in the long run, just to have that more to reduce the in-work poverty among the workforce, then definitely retraining and reskilling will be a must to the workforce. Thank you, Mike.
Thank you so much, Dr. Petia. We still have a lot more questions, but unfortunately, I only have time for one more. And these would go to Asekre, Dr. Cho, and Dr. Orbeta, in that order. This question is from Regina Rosa Hidor. How would you disseminate private and or government policies so that they will not be tarnished by misinformation and disinformation, both on print and digital resource? Asekre?
Quickly, of course, you have to check if it's an official website. There are checks and balances before, for example, for DSWD, before we publish something, any information, it has to be backed up with facts. So of course, it would be two-way as well, no? The publisher and the one who reads the publication. So we also need to fact check if these are indeed coming from reliable sources, and of course call the attention of the official website or the department, no, or the agency, in case there are facts that looks like the facts that look like they do not as they do not seem to be so. So I think that would be my answer, Mike. Thank you.
Thank you so much, Secretary. Dr. Chua?
That's very important. So I understand that, national government, including the SWD, issues a lot of MC circulars, memorandum circulars, providing guidelines and correct information. Kind of trickling down the correct information is going to be very important. Working with the local partners, the MFIs and other NGOs to spread the good information and accurate information is going to be important. But not only just providing information to beneficiaries, but also having a very solid grievance redressal mechanism so that beneficiaries can also provide feedback to implementers are going to be very important going forward. Thank you.
Thank you so much, Dr. Chen. Finally, Dr. Orbeta.
I think that should be self-serving. Check with PIDS. That we are in trying to make our outputs. This one of our job is to educate people, and we are trying our best to come up with products that are easily useful for and readily available from the studies. Of course, we already know that people don't read thick studies, so we are trying to produce products that is easily consumable from our studies, and that's only from the way we understand it. We need your response on how we can make this useful, because that's our aim. One of the mandate of PIDS is to elevate policy discussion. That's why everything that we do is in our website, and we push it through our social media accounts, just to make sure that people get our perspective and of course our comments on many of the issues. Misinformation is a two-way street. It's not only from people will have agenda of providing you information that is from their own perspective. It's also the responsibility of the recipient to check, and we are trying our best as a national institution to provide you information the best way we can. That is understandable, and hopefully, I don't know if we can even go into dialects in the future, but so that it will be translate dialects and our messages. But that's an aim that we have with our information department, so that we can fulfill that mandate of elevating policy discussions and not just on misinformation, to help in trying to control misinformation with facts that we get from our studies. And that's an objective of the institution as well.
Very well said, Dr. Orbeta. Thank you so much. This concludes our forum today. Salamat po to our esteemed panelists and to all of you joining us on Zoom and Facebook Live. Back to our MC, Sheila.
Thank you very much, Dr. Abrigo, for your excellent facilitation of the panel discussion and the open forum. And also thank you very much to all our speakers for the nuggets of wisdom that they have shared with us this afternoon. Let us give all of them a big virtual clap. Okay, so to close this forum, I'd like to invite Dr. Ronald Mutasa, World Bank's practice leader for human development in Brunei, Malaysia, the Philippines, and Thailand. Dr. Mutasa has more than 2 decades of global health experience, and this includes several years of leading World Bank flagship programs in strengthening health systems and reforms in South Asia, East Asia, and Africa. Dr. Mutasa, you now have the virtual floor.
Thank you, Dr. Sheila. Good morning to you all. Magadang Umaga to colleagues. Thank you for your active participation in this important event and for the very rich discussions that we have had throughout the webinar. As our keynote presenters, Dr. Orbeta and Dr. Cho have eloquently articulated, we are living in a world of multiple crises, be it COVID-19, rising fuel prices, rising food prices, the impact of the war on Ukraine on supply chains that is actually being felt on our dinner tables. These multiple crises make social assistance an important pillar of economic and social resilience, and much more importantly, for human capital formation, particularly through protecting access to education, nutrition, and health. I think you've heard throughout this webinar how important protecting investment in human capital is, particularly in this time of crisis. Colleagues, allow me to share just 4 takeaway messages very quickly from this very rich dialogue of distinguished practitioners and researchers. The first point is that many countries across the income spectrum have responded to COVID-19 with expanded social assistance. We know that in the first 6 months of 2020, 96% of Filipinos received some form of social assistance based on the data that is publicly available. But the most fundamental issue that the new administration and all of us should be thinking about is, how does the Philippines build on lessons and institutional mechanisms that were put in place to expand this social assistance during the COVID-19 pandemic to improve the effectiveness, efficiency, and much more importantly, the impacts of social assistance on the vulnerable households in the Philippines. The second takeaway is basically that poverty and disasters are an enduring threat to any country, regardless of income status, and the Philippines is no exception in this. As such, investing in social assistance should be seen as a key pathway to protecting the poor from shocks and to building the physical assets as well as the human capital. As articulated by Dr. Orbeta, the 4Ps program is well documented to be one of the most progressive investments in human capital accumulations of all the social assistance programs in the Philippines. But as we heard from my colleague, Dr. Cho, and many other panelists, we know that there are several challenges that are impacting the implementation and the design of the 4Ps, which include, of course, which actually are manifesting through declining enrollment, and also, of course, very clear evidence that the targeting mechanism is not fit for purpose and could actually better leverage the PIDS information system. And it is very clear to all of us from this conversation that better targeting will improve the concentration and impacts of social assistance on the poor. So this is actually a very important aspect, particularly for the new administration, that investing in a better and well-targeted system is actually going to be a big win-win for the poor, as well as for the administration and for the long run of the economy. The third takeaway message is basically that in Southeast Asia and globally, countries that had more advanced delivery systems for social assistance going into the COVID-19 pandemic were able to rapidly scale up and deliver assistance to households quite significantly. So as we go forward, particularly for the new administration, expanding digital delivery and the use of ID systems leveraging the PIDS system, as articulated by ASEC Rea and my colleague, Dr. Cho, Dr. Orbeta, and many other panelists, is going to be a huge opportunity for the Philippines to be better positioned to deliver social assistance at scale, and also actually to achieve more meaningful results at scale. And then the fourth takeaway message from this rich conversation is that COVID-19 is not going to be the last shock that the Philippines and other countries in the regions or globally will face. This is particularly true when you put it into perspective, the looming global economic crisis. So as the incoming administration attends to the immediate and urgent needs that we are facing within the economy, we must recognize that building a better future also requires building resilience in the face of future shocks. So where does this point us to? This basically points us to investing very significantly in the Philippines to strengthen, modernize, and update adaptive social protection systems that will be key for the future of the Filipino population. Let me end on a note of hope. There are many positives we can draw from the Philippines and other middle-income countries' responses to the COVID-19 shocks, as you heard throughout this meeting. Let us use these positive lessons to further modernize and build up social assistance systems that are fit for purpose. At the World Bank, we stand ready to work with the new administration to advance the social protection systems for the benefit of Filipino families. On behalf of my colleagues from the World Bank and our counterparts at the Philippine Institute of Development Studies, I would like to say thank you so much for this timely dialogue and for the rich set of questions and for the rich set of interactions. We really hope that this timely dialogue will inspire our next economic managers, as well as our next set of administrators in DSWD, NEDA, as well as various other key agencies that are basically going to be charged with the formulation of programs, as well as investments that are going to be crucial to advance this important agenda on social assistance. So thank you so much. And I would like to say back to you, Dr. Sheila, to wrap up this very important session. Thank you. And I hope you are able to hear me clearly. I'm connecting from Washington, DC, and we just lost power temporarily. So thank you, and back to you.
Thank you very much, Dr. Mutasa. Yes, we heard you very well. Thank you, everyone, to our panelists, speakers, and those who joined us online. Your participation made this virtual forum a productive, engaging, and enlightening exchange of issues on the delivery of social protection in the Philippines and how we can make it more efficient and adaptive. Help us make our future knowledge events better by giving us your feedback. When you exit Zoom, you'll be directed to a questionnaire, so please fill it out. We hope to see you again in our future events. Stay safe and have a good day. Maraming salamat po.
Dapat po munang alamin or matukoy ang pangunahing problema ng bansa upang mapagtuunan ng pansin at mabigyan ng solusyon.
We should have specific goals, do research, and make a policy that is fair for everyone.
Walang problema sa pulisiya. Iayos lang ang pagpapatupad.
Bago patubas ang batas, pag-aralan muna gusto ng government.
Two things, clarity and execution. Both, you need the communication and monitoring. As simple as that.
Mandato ng Philippine Institute for Development Studies o PIDS na gumawa ng mga pag-aaral at pananaliksik ng mga polisiya at programa ng pamahalaan at magbigay ng rekomendasyon sa mga mambabatas sa pagbabalangkas ng mga polisiyang makakatulong sa ating bansa. Sinusulong ng aming ahensya ang evidence-based policy making upang bigyan diin ang kahalagahan ng polisiya na batay sa datos at policy research na sumusuri sa tunay na kalagayan ng ating mga komunidad. Napakahalaga ng policy research, lalo na sa mga panahong dumadaan sa krisis ang ating bansa.
Kapag polisiya ay pinag-aralan, susulong ang bayan!